Welcome. My name is Patrick, and I am the father of a hypoplastic left heart syndrome kiddo named Micah, and this is the Micah Mason Foundation review of NPCQIC's Action Period webinar, which took place on March 17th, 2022. Okay, so webinar started with, it was on Zoom. It started with the first big thing, which was they were excited that they had 5,000 patients in the registry. As you know, as a parent of an HLHS kiddo, research into the field is difficult due to the number of patients. That is, they're pretty low. There's about 1,000 or so born every year, just by the numbers. And because it's a fairly rare CHD, the research on it is mostly qualitative and not quantitative because of the low p-values. If you know the statistics behind that, basically, there's not a lot of data points. So 5,000 patients in the registry is a very good thing. It allows the data to be more, the error bars around the data to be better, and the data to be more precise in the kind of tests and experiments, and those aren't quite the right words, but the qualitative improvements that NPCQIC attempts to make. So started with QI tools to start an improvement project. And so this was sort of a brief overview of how to build, or the QI tools used for hospital teams to help doing a quality improvement project. So if you don't know how NPCQI works, NPCQIC has a national arm organization, but really it's a bunch of individual groups at the various children's hospitals. And the group is usually, 1 to 2, or maybe 3 to 4, or 5 to 6, depending on how invested in NPCQIC the hospital is. And that group does quality improvement projects. And so it may be a quality improvement project given to them by NPCQIC via sharing. So it's something another hospital's done that's shown better outcomes for the patients, and so they're implementing it at that hospital. Or alternatively, it could be a new project under a current NPCQIC larger, like tier 3 project or tier 1 project. I can't remember which. Tier 3 is the lower and tier 1 is the higher, or if it's opposite. Either way, there's sort of these initiatives that NPCQIC has gone after over time and is going after right now. And so the hospital in question could be going after one of those initiatives. So if you want to get involved in NPCQIC and their work, quality improvement for other children coming down the line and for your own children, I would highly recommend getting in contact with your children's hospital and asking who the NPCQIC people there are. That way you can get involved with that group, and we'll get into that a little more. So they talked about building your team. You want to have people on the team who know the process, and you want to work with patients and families. So there is a process to quality improvement, how quality improvement works, how quality improvement projects work. There's a good way to do it and a not so good way to do it. And so having somebody on your team who knows how to do quality improvement projects is a boon. And then having patients and families involved is an even bigger boon, because then there's more likely you're going to focus on areas that are more meaningful to the patients and families. And talking about stakeholder involvement. So you have a team, right? And maybe it's doctors and nurses and patients and families, but hospitals are large organizations, and every large organization has a bureaucracy, and bureaucracies have red tape. And the trick at getting a project done within a bureaucracy is always finding the people who can get you through the red tape. Not necessarily cut the red tape, but just get you through the process, through the bureaucracy to get things done. And so they talk about having stakeholders. So getting people who can open doors and remove barriers, and then getting them invested in the project. So they're talking about that being important. And so basically you want people who are passionate about the project, which patients and families often are very passionate about the project. So can nurses and doctors, especially if they've worked in this realm for a while. But then you also want those people who can move the mountains effectively. And so it's always good to try to identify those people as you can and to get them on your side. They talked about how to get buy-in. It was a report out from Children's Wisconsin. And one of the ways they talked about to get buy-in into NPCQIC from other people in the hospital is using automated reporting from NPCQIC. Basically, the automated reporting is a quick way to show that what you're doing has an effect, and it does it automatically. So I run a charity, the Micah Mason Foundation. Every newsletter I put together, or every report I put together, or donor in, donor out, like donations we've taken, grants we've made, that kind of stuff. I have to do all that manually, and I have some software that does some of it automatically, but the formatting is manual, and getting it out to people is a semi-manual process. If I can automate that, then it happens faster and it happens more regularly, and it doesn't require a person to look into it. And so having automated data reporting showing up to you, or showing up to your investors and your stakeholders in your project, is a kind of a quantum leap in communication, because that's always a problem within organizations who are trying to get projects done. Is even if you have the right people to do the project, you don't necessarily have the right people to then keep everybody informed about what's going on in the project, because that's always a piece of any project. You have the thing you're trying to do, but then you also have to tell the people how you did, what you did, where you did it, and both of those are important. And if this part of this process is automated, then you don't have to spend as much time on this. You can spend more time on the thing, doing the thing, the improvement. And so that, I think that's very important. I talked about Norwood outcomes data sharing. So they use data to showcase local and versus national numbers to help drive home gaps and then progress. So this is if you have a local group, so you're working with your team at your hospital, and you basically want to see, okay, how do we match up against the national averages? Like, how are we doing on infant mortality? How are we doing on, post Norwood recovery, post Norwood readmittance between, during the interstage period between the Norwood and the Glen? Like, how do we stack up? And then that showcases gaps, and you can say, aha, we are not doing as good. And this is a way to sell to, the people your shareholders, your stakeholders. You're saying, we're not as good as the rest of the country, this area, so we want to do this project to get here, and this is why. And it's a quick way to show that. So the one after that was the tube weaning project. I talked about the tube weaning project and creating a multidisciplinary team. So what you're going to encounter in NPCQIC is a pretty wide range of projects. So you have ones that are almost entirely clinician sort of level projects, and it's stuff like the neonate score and stuff where they're trying to come up with ways to talk about discharge and ways to look at the numbers and balance the numbers and look at, okay, well, what are the outcome ratios if we do this or if we do that? And so that's all very clinician heavy, very statistics heavy. There are other projects out there that are more, I'm not going to say touchy-feely, but they're more holistic. So tube weaning is a great example, tube weaning projects. I don't know about y'all, but for us, when Micah came home, he had a G button, right? And this was a blessing in some ways, because it means we didn't have to feed him by mouth, and we could just pump the food into his stomach. And he ended up getting a chloris effusion, basically build up in the chest of fatty cells, like the milky substance. And they have to put you on a low-fat diet, and he was on formula, and so the low-fat formulas are terrible. They taste awful. And so it was a blessing to be able to pump that into his stomach. But even that, he came home, he wasn't eating by mouth. And the God's honest truth is 10 to maybe even less, 10 years ago or so, when we were getting involved in 2017, tube weaning was starting to really come into its own as a project. Starting to go around. The reality was most hospitals treated tube weaning of infants the same way they treated tube weaning in adults. And what we found is that is extraordinarily problematic from a psychological point of view. It's not so much a problematic from a nutritional point of view, because the goal is to keep the kid growing, right? And healthy, bigger babies are healthy. It's just sort of that's the mindset we all have. But the reality is you want to keep the child growing, so you want to make sure they get their calories. So any removal of calories from the feed needs to be made up by food by mouth. And what the tube weaning strategies for adults look like, if adult has to go on to nasal tube or a G1 or whatever, if you have to get tube fed, what they want to see an adult do is start eating. And once they start eating, then they back off on the food. The thing is, an adult has a built-up relationship with food. Like over time, like we have been with food, and we know that it's much better to eat something because there's the whole eating thing that's really a lot of fun. Like you can tell I like to eat, and but that's not inherent. It's not an inherent thing to us. It's not like in our genetics necessarily. It is, but it's not. And the tube feeding over time will quickly erase whatever is like naturally there for a child. And so if children don't have the relationship with food, as in like, putting food in my mouth makes it taste good and chewing is fun and so on, if they don't have that built in already, then giving them food, they treat it as a plaything. It's a toy. And some of it's going to make it in their mouth because everything does, but they're not going to eat substantial enough for you to then reduce your tube wean or reduce your tube feeding. So when you tackle tube weaning from a psychological perspective for a child, the reality is you've got to take away the tube feeding first and rely on hunger, right? Because that's the primary driver we all go off of in the first place. Like that's the reason we form our relationship with food in the first place is hunger. There might be other emotions involved, but that's the primary one, right? That's the primary biological driver. And so you have to create the hunger in order to get them to feed. Well, there were no programs like that. And so tube weaning came out of NPCQIC because having to tube feed your child is hell. I don't know how else to put that. Like I mean, you get used to it, but it's pretty terrible. Like you spend so much time, and the more mobile they get, the harder it gets, the harder it takes to keep the G button in, to keep the things working, and it makes life nightmarish. And the sooner you can get them off that tube, the better life is. Almost period. Across the board. And so this was a project that was extremely, extremely driven by parents because we didn't want to live in hell anymore or with this nightmarish scenario of tube feeding our children. And then eventually the clinicians got involved because they realized, well, it really is a problem too, because there were people growing up who were tube fed their entire lives, and they would be, in their 18, 19-year-olds with tubes, and they wouldn't eat. They wouldn't eat food because they didn't like food. They didn't think it was a good thing, and because they were always tube fed. And so we didn't want people to end up that way. That's on the other side of the ball because it's just a harder life. So that was a project really driven by parents. And so let's talk about those kind of projects. You want a multidisciplinary team. You want a team that involves, doctors and nurses and parents and patients if you have them. If you're at that level, like the Fontan's Outcome Network is more likely to have patient involvement than NPCQIC because NPQIC is from birth to, well, it's really pre-birth at this point because they do ultrasound kind of projects, but all the way till first birthday. And so Fontan Outcomes Network is sort of first birthday and beyond, is trying to come up with quality improvement for Fontan patients, which I'll talk about a little bit later. So, but you want to get everybody involved. And this also includes, in more recent years, mental health professionals. Like I said, the tube weaning thing was really a psychological problem, not a biological problem. And so having psychological or mental health professionals involved would be good for a lot of different projects. And so that's something. Talked about tube weaning, but there are other projects that can benefit from that. Next thing they talked about was the spring learning session. So that's coming up pretty soon here. It's in April. So we're in April. I'm recording this on April 9th. Hopefully we'll have this out on the 10th or the 11th. And it's coming up pretty soon, like next week. So if you want to get involved in NPCQIC at a national level, or just see what's going on for improvement of care for HLHS kiddos between the birth or pre-birth all the way till first year, then please check out the spring learning session. You can join. You don't have to have a center. You don't have to be a professional. You don't really have to have much other than a phone or a computer that can access Zoom. So get involved. I'll have a link below in the comments section to direct you to the website, to NPCQIC's website, and to get into the April webinar. They talked about what's coming up for that, the roadmap project. And so this is sort of a more overarching thing, and it's being promoted by the American Board of Pediatrics Foundation. And it's looking at emotional mental health for families living with ongoing chronic illnesses. And so it's overarching the American Board of Pediatrics because we're not the only show in town. Like cardiac kids or kids living with congenital heart defects are not the only kids that have ongoing or chronic illnesses, right? But what we've realized is we've moved into a realm where we actually pay attention to mental health a lot more, mental and emotional health a lot more as a society. We realize parents who have children and families with children who have chronic illnesses have a lot more emotional and mental health struggles, both the parents, siblings, and the children themselves. And so the roadmap project is an attempt to address this. And so it's not just like heart folks. It's not just us here in the heart world. It's a lot of different other groups. And so that's why the American Board of Pediatrics Foundation is kind of sponsoring it and putting it on, because they want input from all different sectors, from kids who live with chronic illnesses and their families. So I think that's really cool personally. I'm looking forward to watching the roadmap project and maybe participating. We'll see. And then they went over network updates. So they had 6 new publications, and those are available on the website. I'll put links to them. So publications are one way NPCQIC gets its word out about things that worked to other hospitals. So they public and scientific and medical journals, and they say, hey, if you do this thing, then we saw better outcomes in children in this way. And that gets the word out to all hospitals or anybody who's paying attention to that medical journal. And that means that people even not in NPCQIC's network could benefit from NPCQIC's work. And so I think, the publications are very important. They're very technical. They're very medical. So if you're not, a statistician or a statistics guy or a nerd like me or really interested, or a medical professional, you may not be terribly interested in reading it, but you might want to read the summaries just to see the kind of project work that gets put out to the rest of the medical community. CNU, so Cardiac Networks United, which we're big supporters of at the Micah Mason Foundation, they are doing a training session on QI education, so quality improvement education. So kind of the what, where, why, how. So quality improvement is always a good thing, but how do you do it? Like, how do you improve the quality of the product you give? And there's lots of different methods and ways to do that. I work in electricity production, and we have our own quality improvement program. Everybody does, like all industrial groups do. And there's a variety of different ways to do it, and a variety of different ways to approach it. And some work in the medical industry and some don't. And so Cardiac Networks United is giving sort of a training program for quality improvement. And so if you have a center, if you're involved with the center and individuals there would benefit from quality improvement training, check out Cardiac Networks United Quality Improvement Training. And then that was pretty much the end. And the next action period call is going to be June 16th at 3 p.m. Eastern time. So these action period calls are about an hour. They are an hour long. Sometimes they're very technical, and sometimes they're not very technical. I thought this was probably one of the best action period webinars I've ever seen, and I've been watching for several years now, so I have a little bit of experience. But this one was really, really good, and I'm very excited for everything that's going on in NPCQIC. I also want to give a plug, because they give a plug for it, but the Fontan Outcomes Network is sort of kicking off now. It's sort of the same structure as NPQIC, and there's even been some talk I've seen of there being more interconnectedness than there seemed to be at initial. I mean, granted, a lot of the same people who are involved in both organizations, or some who are involved in Fontan Outcomes Network, were involved in NPCQIC, so it's not unexpected. But if you are the parent of a child who has HLHS, who has the Fontan circulatory setup, try to get involved with Fontan's Outcomes Network if you can, and try and get your center to get involved, because they're unlike NPCQIC, which has a large number of centers. By centers, I mean hospitals, children's hospitals involved with them. Fawn doesn't. So it's a new organization. They really just started last year, the year before, and they've been building kind of their network, and they're starting to come out with projects. I think is going to be, and they're, like I talked about, the spring learning session is coming up for NPCQIC. Typically it's 2 days, and then the third day is the Fontan Outcome Network spring learning session. And so it's a 3-day sort of thing, but it's technically 2 different organizations, but they're still, I mean, it's, NPCQIC is children pre-birth all the way to first year, and then Fontan for most HLHS kiddos for them, although there are plenty of HLH kiddos who don't get the Fontan surgery, and so they're a different circulation. But ultimately the goal is to improve outcomes, to improve medical outcomes for all of those kids. So that is everything that was covered, the Action Period webinar. I'll have a link to the actual Zoom meeting so you can watch the meeting and get everything in much more detail than I gave you, and links to Cardiac Networks United, to NPCQIC's new publications, and to signing up to their spring learning session. Please get involved. They are really, really looking to get more parent involvement, especially at the center level. So please reach out to your centers, ask them about NPCQIC if you want to get involved, if you want to help. This is a great way to help. So thank you for joining us. I am Pat with the Micah Mason Foundation, and we are all in this together.